Hi, good morning. Today I want to talk a minute about pathologies. I know that seems like a strange topic, but it's one I want to touch on. I see so much of other people's videos, whether it's on Reels or TikToks or YouTube, and people are diagnosing. I see this in my own office. People come in and think, I have XYZ condition, or I think I'm XYZ. And I want to talk about what that means. One, a diagnosis is a big deal and is helpful for a doctor because meds can be prescribed. And in that regard, so be it. But I think what is more helpful is understanding symptoms. And what I think we do in therapy is we look at all the symptoms that are bothering you and we address and treat those. Now, when the symptoms and the collection of symptoms become so great and therapy isn't quite enough, then it's time to really start considering diagnosis, because you got to talk to a doctor about it. I tell my clients all the time, I diagnose very, very slowly. I come from a school of thought, being narrative therapy and solution-focused therapy, where diagnosis is not the first line. Not that we don't acknowledge it. So a lot of people that are familiar with those theoretical approaches, it's not that diagnose isn't acknowledged, it's just not the first line of prescription, so to speak. So it becomes useful for the idea of, I need to send this to a doctor to consider medication. So that prescription and that diagnosis at that point is super helpful. But here's the deal about pathologies, diagnosis. It is a collection of severe symptomology. It is a collection of criteria and in their most severest forms. We all have mood instability from time to time, right? Women, we get PMS, we get moody. Everybody has ups and downs in our moods. That does not mean we all have bipolar disorder. We all get down. We all have days where we feel really sad. That does not mean that we have a clinical depression. We all have symptoms of social anxiety or social awkwardness, or maybe we don't make perfect eye contact with every single person. That doesn't mean we have autism. So when people come in and they say, I think I have XYZ, I'm very hesitant to say any of those things. And I see some of the videos on our social media platforms, and I want to be very careful in endorsing any of that, because one, it takes a very well-trained clinician to make any type of diagnosis. Two, diagnoses of any kind need to be done thoughtfully and over time, and taking into consideration all clinical aspects, and understanding that pathology is a collection of criteria specific to these diagnoses at a severe level, and understanding that there are lots of overlaps of symptoms that range from normal behavior to clinical behavior, and that span from multiple conditions. So what we find from Google or WebMD or even your, regular perusal of some snippet of the DSM, if you aren't a trained clinician, can be really scary or give you a false sense of clinical knowledge. So I want everybody to be really, really hesitant before you self-diagnose or diagnose your friends and family. because pathologies are actually very rare. It's a very small percentage of our population that truly has any real pathological condition. We all suffer from certain symptoms at certain times, but even then, the severity to which it would actually be a diagnosable pathology is rare. So go to therapy, treat the symptoms, and trust that your clinician will have the knowledge and expertise to help you. And if there is a diagnosable condition, that they will work with you to do that. And if it's diagnosable and it needs medication and psychiatric care, that they will get you referred to the helpful place. So that's my 2 cents on that. And I hope that it is received with the love and thoughtfulness in which it is intended. Please don't self-diagnose. Really. It is a big, big deal. These are big, big things that nobody needs to label themselves with. You are not the problem. It's just a thing we can work on. Trust yourself.